Hello, my name is Erik Young, and I'm doing my project on postpartum depression. I picked this topic because it's something that I've never really understood before, and I've always been interested in it. Introduction. Postpartum depression is like very undiagnosed condition that can be treated and prevented through mindfulness as well as other therapies. My main issues are postpartum depression's misdiagnoses, as well as mindfulness as a prevention technique. Postpartum depression is diagnosed in 13 to 20% of mothers, but up to 50 to 80% experience some kind of postpartum blues after giving birth. But it is important to note that postpartum blues and postpartum depression are not the same thing, and postpartum depression is different because of the duration of its effects as well as its intensity. But if it is not diagnosed, then it can lead to the mother not receiving the treatment that they need. Now, women that enter pregnancy that have a history of like depression and anxiety in their past, they have a higher chance of having postpartum depression and in turn passing on those kinds of symptoms onto their children. Um, for postpartum depression, antidepressant medication is mostly ineffective and has a high relapse rate, and that relapse rate can go up to 70%, which means it's fairly ineffective. Um, but meditation practices have shown to be preventative. So if the mother has like a daily meditation, maybe they have positive self-talk in their head while they do the meditation. That's helpful to prevent and treat postpartum depression. And these do have a lower relapse rate as and as well as not causing side effects like medication does. So, potential impact on health and wellness. So, symptoms of postpartum depression include irritability, negative thought repetition, and loss of interest that the mother was passionate about before, and weight gain or weight loss because of the appetite changes that can come with the moodiness. The mother's postpartum depression can have a negative impact on their child's life. It can cause them to be more likely to experience behavioral problems like acting out in school or at home, and it can cause them to have depression in their own lives. Um, and postpartum depression can escalate into postpartum psychosis, which can actually lead to suicide or other horrible acts. There are several risk factors that increase the likelihood of developing postpartum depression, the main one being a history of having anxiety or depression. Many women with these conditions think that having a baby will cure their symptoms because it'll give them a feeling of purpose, but that often backfires and worsens their symptoms. Poor partner relations can also lead to postpartum depression as well as an abusive past for the mother. So there are several prevention techniques to help prevent the symptoms of postpartum depression. Meditation and mindfulness can be very powerful prevention tools as well as reassurance for the future. So if the mother can like tell herself in her head like, oh, it's going to be okay, like my child's going to be okay, I'm going to be a good enough mother for them and everything will be fine. Then that's like a powerful technique to not get these symptoms, as well as exercise and a healthy diet. Um, but almost most importantly, like early screening for this condition can vastly shorten its duration and intensity because if it can get caught quickly, then like therapy can be taken quickly and it can remove the symptom. There are five components of health affected with postpartum depression. These include physical health, which is affected because the individual may stop taking care of themselves as well as they did before, and it can cause weight gain and weight loss. Maybe they stopped working out, maybe they stopped eating well, things like that. Social health can be affected by the individual, like not having connectivity that they used to. Like they're not going out with their friends as much. They don't have a strong relationship with their partner and with their family. Uh, Emotional health is probably the most affected component of health because it can cause like crying uncontrollably, and they often feel feeling of sadness, of guilt, of irritability, mostly because they feel they are not going to be a fit mother for their child. Intellectual health is another component of health which can be affected because the individual is often too upset to be motivated to fight the condition on their own. Environmental health can be affected as well, like hygiene can be affected, or like if they don't drink enough water, if they have an unhealthy diet. So the applications and relationships to the field of public health. The strategies that are currently used to fight postpartum depression are cognitive behavioral therapy, which is a therapy that is one on one with the patient and the therapist. And the therapist will continuously ask questions to the patient of like why they feel a certain way, and they will use logic to like unravel the statements and help the patient realize that there's no real reason to feel that way. Antidepressants are often used uh, as well as therapy, like together. And then SBIRT, SBIRT, is an intervention and referral treatment that someone that isn't a therapist can use, so they can uh, track like the effect on their bodies, and then they can refer them to someone else that can help them better. The alternative treatments for postpartum depression include demystification, which is a type of therapy that takes away all the unknowns for the mother, as well as lets them know that they are not alone. As gross as the picture at the bottom right is, acupuncture can also be used on pressure points to treat this condition. Solution focused counseling is another type of counseling that is used to fight this. It's very similar to cognitive behavioral therapy, but it's less used. Recommendations for anyone that is maybe struggling with this condition or is pregnant or hoping to become pregnant would be after giving birth or even during pregnancy, it's important to be screened for this condition because it's common and it's also commonly misdiagnosed. So you want to make sure that treatment is had if it is necessary. Um, Also, alternative treatments may be as viable as mainstream ones, and they also have less side effects. Like, I know antidepressants can make you just feel groggy all the time, but other therapies won't do that. And it's important to know that there are support groups out there for women who do struggle with this condition. Things to think about regarding postpartum depression. This condition is actually not specific to females. Males can also experience postpartum depression, especially if their partner is already experiencing it. This can be due to a sympathy effect and can depend on the closeness of their relationship. Also, price can be like a big factor regarding like what treatment is used, but it's important to use the one that has the best effect and not just the lowest price. Last thing to remember is that fighting depression is an active process. It's not easy, and it isn't just going to go away without the individual working hard and getting therapy, maybe getting medication, acupuncture, whatever they need to get rid of it. And these are my references. I have 12 of them, and they are all academic journals. Um, I just wanted to thank you for this course because it was a lot of fun and I learned a lot of things that I did not think that I was going to. And so thank you